Yeah.
Do I ding the bell?
Yeah. Gotta ring the bell.
Hey, it's time. It's been a while. But welcome to Rotary today. Our Jack Craft will be our Rotarian of the day.
So this is not a beanie. It's called a yarmulke, or in Hebrew it's called a kippah. And Jews wear this when we pray, and we do that out of reverence to God and out of respect to God. So as I've done in the past, some of this is going to be in Hebrew. I'll translate it in English, and then part of the prayer will be something that you're all familiar with. Shema Yisrael, Adonai Eloheinu, Adonai Echad. Hear, O Israel, the Lord our God, the Lord is one. Baruch atah Adonai Eloheinu melech haolam, hamotzi lechem min haaretz. Blessed art thou, our God, King of the universe, who brings forth wheat from the ground. Baruch atah Adonai Eloheinu melech haolam, shefiyanu v'kiyamanu v'higiyanu lazman hazeh. Blessed art thou, our God, King of the universe, who grants us the opportunity for this special day for all of us to be together. Hashem, we thank you for the bounty that we all share. We ask you to provide guidance and protect those in this room and in this organization. We ask you to please provide guidance to the leadership of our country, our state, and our local community. And in your name, amen. Amen. Next, the pledge of allegiance. I pledge allegiance to the flag of the United States of America, to the republic which stands one nation under God, indivisible. The four-way test. First, is it true? Second, is it fair of all concerned? Third, will it live? And fourth, yeah.
All right, thank you, Jack. Oh, yep. Sergeant at Arms. Here she comes.
So we have our speaker today, Ray Jones, and he has with him Linda Sandos. Did I get that correct? And Dorothy Davis. All right. Last four. 6173. 6173.
We're not ours.
Oh. It's under 7, but over 60.
Yeah, so like I said, keep half for the club. I put it into the foundation, and the other half I'll take.
All right, Dawn, you heard that?
Awesome. Thank you, Jack. Let's see. Club announcements. Stephanie?
So, y'all all hear me? As many of you know, we are going to Phelps Brothers next week for a tour at 12 o'clock. So there will be a lot of walking. So wear comfortable shoes, bring them with you if you wear shoes like this to work, something like that, like me. Wear comfortable shoes. There will be a lot of walking. Parking, she didn't seem to think that was going to be an issue, so hopefully it will not. If you can carpool, that would be great. It might make it a little easier. We will have to go in 2 separate groups, divided up just because it's easier in maneuvering around the plant and all that kind of stuff. So, and then once we are finished with the plant tour, we will have box lunches to go. But I think they were going to set up a side room for those that wanted to stay and maybe eat that box lunch there. If not, you can grab it, head back to work for those of us who got to get back to the office and such. So I am going to, one of the things that she needs, because they are required to do so, is, security badges or clearance, because the plant has gotten so much larger than last time we were there several weeks ago. So I need first and last names of everyone that plans to attend next week, please. I'll also be emailing out for those that aren't here to send me their names as well. I'm just gonna start this, and y'all will just kind of sign and pass around. I think that's all I got on my. That's it.
All right, okay, thanks, Stephanie. Jan has a community, Jan will be back with us shortly. We have an Interact presentation and she has an announcement, but I guess in the meantime, do we have any community announcements? Anything going on anywhere in May or the next week or so?
Lots of graduations.
Oh, yeah. Graduation.
Yeah.
Well, like I said, give us just a minute. Let Jan get back in here. She's wrangling some students in the parking lot, okay? You'll see in your bulletin, there's at the John Marler Art Center an exhibit, The Big Click, and then Milledgeville Burger Week is next week. That's exciting for some, but yeah, that's where we are. So give us just a minute. Let me round up Jan. Here they are. These are our Interact students. Jan, you want to come on? We're done with our announcements. You can make your community announcement up here too if you like.
Get out of the building because all the graduates are doing the grad walk to all the schools today. They didn't see Devin coming out and they're like, oh no, you can't go out this door. And I'm like,
Oh, no worries.
it's on the door, and then yes, they will tell on me. I did get turned around.
No worries. You're here now. Or just,
Yeah, it's just one of you.
yeah.
There's two.
There's two.
Yeah, getting
There's
out
a-
there. I'm right here. The day is not.
Jan, you want to go ahead with your community?
Yeah, I'll go ahead and do that. While they get settled. Is it just this little thing? I'll just try to talk real loud, okay? While the Interact students get settled. You know how school goes, they can only have X amount of time they can be out of school, so. I have a favor to ask the club members. Our Ryla student, Kayla Wright, needs transportation to Ryla. This is something that the club agrees to if the Ryla student needs it. Most of the time, the parents take them or they drive themselves, but this year is a little different. She needs to be at Coastal Community College, Coastal College in Brunswick on June 11th between 1 p.m. and 3 p.m. That's a Wednesday. Then she needs to be picked up that following Saturday. They end at 10:30, so they need to be picked up real close to 10:30. So if anyone can do both ways, one way, I would really, really appreciate it. Unfortunately, there's no way I can do it on the 11th. I've got some other obligations I can't dismiss. So if anyone can help out, just see me at another meeting or call, email, whatever, and let me know, please, okay? So, okay.
I guess maybe if you put that in an email and get it to our secretary and they can get it to the
Okay,
club.
yeah,
That'd be
I'd like to
that'd
do
be a
that
good thing to
too.
do.
Okay. All right. May is Youth Services Month, and we like to go ahead and honor our Interact Club and recognize the seniors. We have Miss Christina Rogers, if you'll stand up. Miss Rogers has been the advisor, the school advisor for the Interact Club for the 3 years. She's moving on to other things, and Miss Laurel Tucker, who is not here unfortunately, will be taking over for her the next school
She's
year.
expecting her grandbaby any second. So,
Yeah, she's,
I told her, yeah, family comes first before everything, so.
yes, Miss Tucker didn't want to miss the birth of her grandchild, so I don't blame her. If I can have all of the Interact students just come up here, please. I know you're all hungry, you'll have lunch in
I'm
just a
really
minute.
sorry, guys, this has just not been my year, so let's talk about that. But we still try, one day at a time, right? 1 hour sometimes, so.
Yeah. What I'd like to do is to have you all introduce yourselves. Tell you, Alyssa, you come over here. Tell what year you are, and this is not all of the members, this is just the ones that could get permission from the parents and from the teachers to come and so. And yeah, the bus and all that. Tell who you are, the year you're in school, if you've held an office this year, and if you're a senior, what your plans are for next year. So, we'll start with you,
Hey,
Alyssa.
I'm Alyssa. I'm the president. I'm in 12th grade. I said my plans, I don't really know quite yet, you know. I'm still thinking it keeps going back and forth, so, yeah.
She's engaged to a service. So she will be, getting married and following him and working on basis. So yeah, she knows how to do it.
Sergeant, I'm the vice president. I'm a senior in high school, and my plans for next year is the Air Force. And about it. My name is Bill McCoy. I was ordinary member. And I plan on joining the Marines. If it goes to plans, I'll be out May 20th. In the boot camp.
Yeah, he has to graduate early.
My name's Scott Wood, I'm an ninth grader
And you may run for officer of our club.
my name is Bradley, I am a sophomore, and next year, I don't have an office this year, but I will be running next year. And I'm 16, my birthday's coming up February. I was planning to go to the Navy and study leaving for college.
Yeah, many of our members are looking to join the military or like Alyssa, who supportive of the military. My father was in the Navy and I work really closely with ROTC, so Major came with us a couple of times as almost a co-sponsor, so we're trying to give back to our community. And some people don't have a lot, but they've learned that they can still help.
Okay, in addition, Alyssa is a charter member, she's been here all 3 years. Evan is a 2-year member. Madison's been here
Yeah, it's 2 years.
2 years, and both Caleb and Scott are 1-year members, and Scott and Evan are.
And that's their
So, and that's their mom, yeah, who they don't come. Our other 2 officers, Vix McNeely is a junior, and is the treasurer, and Rayleigh Martin is the secretary, and she's also a junior. What I'd like to do now is present the seniors with the Interact sash that we give them. I've pulled one out so you can see it. This is their graduation sash that they get to wear at graduation. Really nice.
And it really pops with that black hat here.
So,
And our juniors had a milestone today. So Alyssa actually had it today and we were able to come, but they were afraid. They didn't want to miss anything. So our juniors wanted it. Like I said, I'm looking for the bus. I think it's her. It didn't get around. So then I had to tell everybody, you never waited. So
all right. You're
we
welcome.
ended up getting like 3 different cards.
And the last thing, once again, the third year in a row, the Interact Club has won the Zone 34 Rotary Award. This is a zone award, not a district. And what can I say? But they're good. So third year.
Thank you guys for, sponsoring us and supporting us. We just want to give back, to the community that raised these wonderful young people. And I try to tell them, I grew up in Newfoundland, Canada. If anybody knows where that is, congratulations. It's where the Titanic is, where that thing imploded, last year. But, Rotary's everywhere. So I remember hearing about the Rotary and doing things, for the Rotary when I was growing up. So when I was approached by Dr. Price to start a club, I already had one, and I was like, another one. Okay, I have 2 children at home, but they have really, really impressed. We have done so much to help our community and the world. We really do make a difference with your help. So thank you so much for supporting us. Let's turn the middle in front of y'all so she can be seen.
Yeah, yeah, yeah.
Cause I'm short. Oh, guys.
Thanks.
I am taking. Oh, you can't get on the bus. You don't have your heavy down on it.
Great job, you guys. I guess now Stephanie want to introduce our program today.
I'll do a quick introduction so he can get up here and start his program. But Mr. Ray Jones is with us here today. He's with Atrium Navicent out of Macon, and he's going to talk about the cardiovascular, things, labs, all of the things that he's opened and started and different places and all of that. So please give a warm welcome.
Pardon us for a second. We're having to redo the computer configuration.
Did it unplug? There it is.
There we go. Better with hearts than I am computers. Promise you. What a nice group, really nice group. And thank you for having us here today. We feel like it's very important that we get these opportunities to get out in the community and raise awareness for these various cardiovascular disorders. So thank you very much for having us. Our goal today is going to be just basically to raise awareness of atrial fibrillation and hopefully to provide you with some information that hopefully will empower you to make changes in your life or lifestyle that will prevent you from having this to begin with. As good as we are on the back end of correcting these things, we would prefer that it not happen in the beginning. So again, thanks for having us. We've prepared a short slide or short presentation to try to go over some of these things. Now, I frequently say that your heart, at least structurally, always reminds me of your house in a way. Your house has walls. Your walls in your house are made out of sheetrock and wood. Your heart has walls. They're made out of muscle, but not just any muscle. It's cardiac muscle, and that's a different kind of muscle. And we'll come back to that again later. But your house has plumbing. Takes your water into your house and out. Your heart has plumbing, cardiac coronary arteries and veins to bring the blood in, take the blood out. Your house has electricity. Brings your electricity in so you can run your refrigerator, video games, and your lights. Your heart also has electricity. A lot of people don't realize that. That electrical system can have any number of issues, problems. And one of those is atrial fibrillation. And that's what I wanted to talk to you today about. Does anybody here have atrial fib or know anybody that has atrial fib? We have a winner.
I don't have it. I know
Here,
my
too.
stepbrother.
Good deal. Well, just a quick overview. Atrial fib is an abnormal rhythm of the heart. It's relatively common, affects about 2.3 million people in the US every year. Prevalence increases with age. Most people who develop AFib are greater than 65 years of age. That said, there is emerging data that suggests that COVID may have had some influence on the prevalence, or at least the instance of atrial fibrillation. It could be affecting our numbers. And I do data abstraction for our hospital, and I can tell you that I'm seeing younger and younger people that are coming in with atrial fibrillation all the time. Atrial flutter, it's a related disorder. It overlaps with AFib with respect to mechanism, management, and prognosis. You can have AFib or you can have aflutter. You can have both at the same time. The treatment modalities are the same. So what is it? What is AFib? This is what happens in AFib. The upper chambers beat erratically. Normally, every single heartbeat is generated from one cluster of cells in your heart. One small cluster of cells is called the SA node. It's in the right upper chamber of your heart. And you can look at it like a spark plug. You got a spark plug. God gave you a spark plug. Good system, works well. In atrial fibrillation, it's almost like you have maybe a dozen, 2 dozen spark plugs firing at the same time. Normally that one cluster fires and it sets off a chain reaction. Like your lawnmower has one spark plug. You pull the cord and it runs in a predictable rhythmic fashion. It's like that with your heart normally. So the top part beats, it's in sync. In AFib, the top part beats very erratically. It quivers more than beats. And that causes blood to pool. And it's not moved out of the atria very effectively. And it affects the pumping action of your heart. It can lead to clot formation. And we're going to come back to that more in a minute, as well as the risk of stroke. Stroke is one of the bigger risk factors with atrial fibrillation. There's two types of atrial fibrillation, and actually more, but two main types are paroxysmal atrial fib or intermittent AFib. These episodes occur on varying frequencies and durations, but they usually resolve within 7 days. So you can come in and out of atrial fib very quickly. You can be in and out and be out of it in 10 minutes. People frequently have symptoms, but paroxysmal, it usually resolves in 7 days. Persistent or chronic AFib continues for at least 7 days, and it usually requires an effort at restoration of a normal heart rhythm. Now, this is a video I had, but it's kind of wonky today and it doesn't want to play. So what are some of the causes of atrial fib? Some of the causes, quickly, increased age. We already said over 65 years of age puts you at a higher risk. Underlying heart disease due to chronic high blood pressure, prior heart attack, heart failure. Interesting, heart failure can cause atrial fib. Atrial fib can cause heart failure. When your heart's not beating effectively, that muscle loses its elasticity, loses its tone, and over time you can get heart failure from it. Heart valve disease, mitral regurgitation, mitral stenosis. We see an awful lot of atrial fib because of a faulty valve. You go in and have a valve job, valve repair. Frequently, the AFib will go away. Diabetes, it's a strong risk factor for atrial fibrillation. Chronic kidney disease, complications from surgery due to the heart, the scarring in your heart. It interferes with the electrical circuit. All these are some of the causes. Alcohol and binge drinking, big one. I've seen a lot of people that they never have AFib ever until they've had a few drinks, and then they get AFib and they have to have an intervention to get them back into a normal rhythm. hyperthyroidism, certain medications, theophylline is one of them. Sleep apnea. Do you know anybody that snores? I do. And we get a big kick out of picking on people that snore, but the reality of it is when you're snoring, your airway is getting closed off. You're getting hypoxic. Your oxygen level in your blood is dropping during the night. That can cause your heart muscle to weaken. You can get heart failure, and it's a very strong indicator for atrial fibrillation. Many of the cases that I see every day are the patients have all of these things. They'll have heart failure, hypertension, and obstructive sleep apnea. There are things that you can do about that. And if you snore badly, I encourage you to go to a sleep specialist. There are things that they can do to help out with that. Obesity, big risk factor. Smoking, horrible thing to do for your heart. This is where we tend to scare people sometimes. And I want you to understand from the beginning that AFib is not the only thing that can cause these symptoms. There are a lot of other things. It doesn't necessarily mean that you have AFib. So we'll go over some of them. Some of the milder symptoms are unpleasant palpitations. If you ever felt like your heart was skipping beats or fluttering, that's a symptom. Again, it doesn't necessarily mean you have AFib. Mild chest discomfort, a sense of a racing heart because your heart is racing. Frequently, we'll see a heart rate up as high as 160 or 180, sometimes even higher. And you can imagine that would cause you a certain amount of distress, very uncomfortable feeling. Lightheadedness because the muscles are not contracting appropriately and the blood's not pumping from the heart. So you're not getting blood to your brain. You can have syncopal episodes or faint and fall out, hit the ground. Mild shortness of breath and fatigue, especially with exercise, and these symptoms can come and go quickly. Some of the more severe symptoms, and they can get quite severe. Severe difficulty breathing, especially with exercise or exertion of any kind. Fainting, near fainting, due to the reduced blood flow in the brain. Chest pain. Sometimes we identify atrial fib for the first time in patients that come to the ED complaining of chest pain, thinking they're having a heart attack. Oddly, sometimes a heart attack can precipitate a bout of atrial fib. Severe fatigue. We see people frequently who have absolutely no symptoms. They don't have any idea they have it. They go to their doctor for a routine EKG or come to the ER for whatever reason, get a routine EKG, and we identify it there. Other people have these profound symptoms. So it's a very frustrating thing to try and run it down. And some of the complications, I'm just going to talk about two primarily here today. They can be numerous, but two of the biggest ones are stroke and heart failure. And I'm going to touch on those again in just a few minutes. So how do we diagnose it? The only way to diagnose it is with an EKG or a Holter monitor. You know what an EKG is? A Holter monitor is a monitor your physician will put on you, and they typically will stay on you from 10 to 30 days, sometimes longer, because this rhythm can come and go pretty quickly. Maybe here, gone in just a matter of minutes, but over a period of 10 days or 30 days, will likely capture it if it's happening. So you take the monitor back to your physician, they'll review it, and sometimes that's the way we identify it. So how do we treat it? Electrical cardioversion is one way. You've probably seen it on TV where we take the paddles and we pop you on the chest. It's fairly traumatic. That's one way we do it. It's not really the way it works out in the hospital, but that effectively resets the heart. And when it starts back, hopefully it's in a normal sinus rhythm. Sometimes it works, sometimes it doesn't. Sometimes it works for a few minutes and you go back into an atrial fibrillation right away. Sometimes it lasts for a good while. Pair it up with some with medication. Sometimes it is very effective. There are medications that we can use to convert you back to a normal sinus rhythm. Basically, the treatment consists of three different things. It's always going to be rhythm, rate control, and anticoagulants. Again, cardioversion or antiarrhythmic drugs, amiodarone is a very popular one. Sometimes a pacemaker will not pace you out of atrial fibrillation, but it will pick your rate up. Sometimes if you go from atrial fib to sinus rhythm or sinus rhythm to atrial fibrillation, your blood pressure drops very low. You get lightheaded, you can pass out and hit your head. The pacemaker, all it does is picks your rate up to keep you from having those episodes. But sometimes those are required along with anticoagulation therapy. Rate control, sometimes we simply aren't able to get you out of AFib. It's frustrating, and for those patients, we concentrate on rate control, beta blockers, calcium channel blockers, that kind of thing. Digoxin is another good one. They almost always all require anticoagulation therapy because of the clotting. We said that in atrial fib, all these spark plugs are going off, your heart's not pumping. Well, what happens to blood when it's not moving? It clots. It clots quickly. And there's an anatomical feature in the heart. It's called the left atrial appendage. And it's just a pouch that hangs off on the left atrium. For years, we thought it didn't have any use like we used to think about the appendix. We now know that it does have a purpose. God doesn't put things there that don't have a purpose. 90%, this is shocking to me. 90% of all embolic strokes are caused from a clot that came from the left atrial appendage because the heart's not pumping efficiently. 90% of all embolic strokes. So it's absolutely critical that you on anticoagulation therapy to prevent that. They're about 70% successful. Some non-pharmacologic treatments include catheter ablation, uses of, and that we track down these arrhythmias. We find out where they're coming from. Believe it or not, we have the technology to do that. It's very interesting. And when we find these extra spark plugs, to use a complicated medical term, we zap them with heat or cold, and we kill it. And the equipment is designed to burn only cardiac muscle and only in the area where the arrhythmia is coming from. And the procedure is very successful. Again, we talked about pacemakers that it won't get rid of AFib, but it will keep you from having these syncopal episodes. It helps to prevent slow heartbeats when you go from one rhythm to the other. There is a procedure called a maze procedure, and it's always done during open heart if you have to have bypass or valve repair or replacement for another reason. It's never done as a standalone treatment. It's done during these open hearts where they insert a fishnet looking device, and you're able to get more of a controlled burn. The atria, they're very thin, and when we do these burns, one of the risks is burning completely through it and causing blood to cause another problem. It can happen. It does happen occasionally, not very often. But during a maze procedure, you can directly visualize it, and you can get a much deeper burn, a more controlled burn. So they are quite successful. But again, you would never do it as a standalone treatment. We already said AFib increases the risk of clots. I won't rehash that. The drugs are very effective. There's also another treatment. It's a mechanical device. I don't know if it's showing. It's called a Watchman. Watchman is a relatively new device, and it's kind of like an umbrella, and we deploy that through the groin up into the heart, and we go into the appendage that we talked about, the little left atrial appendage, and we deploy this thing, and it opens up like an umbrella sort of, and it's like a mesh, and we leave it there, and that blocks the appendage off if there's clots. So first, we'll do an echo to see if there are clots there. If there are, it won't do anything. But we'll deploy this thing there, and it keeps clots from forming to begin with. Very effective. It's comparable to blood thinners in terms of reducing the risk of stroke. And we do an awful lot of them at Atrium and Macon.
Leave it in there?
We'll leave it in there. Over time, that mesh endothelializes. So the tissue, your muscle grows around it. It's all like a stent. We have to put a stent in your coronary arteries. Over time, just like a tree grows around the fence when you nail it to it, the tissue will completely endothelialize. And it's completely sealed off after that. Lifestyle changes can help. This AFib is very frustrating just because of, like we've already, you can see from the things I've told you, it comes and goes, it's very transient. A lot of other things can mimic um, the symptoms of AFib, but there are a lot of modifiable things that lifestyle that you can change that will help out. Obesity, it's not uncommon that we see people with AFib. If you lose weight, the AFib goes away sometimes, goes away for good. Easy to say, right? It's easy to say lose weight. It sounds easy, but a lot of people, it's just not that easy. It's much easier said than done. But it is a controllable factor. Smoking. We also see people that smoke. You quit smoking, your AFib will go away. Sometimes alcohol consumption. Our EP physicians, their general rule is 2 drinks is a safe amount. When you get over that, you run the risk. A nurse that worked for me at another facility had a 2% body fat. He ran as a marathon runner. He was on vacation in Hawaii, and he called me over his breakfast. He had AFib, just out of the blue. The guy was like, "You couldn't get in any better shape than this guy." Interestingly, extreme athletes like him are also at high risk. It's not uncommon to see these guys that do a lot of CrossFit come in and they're in atrial fib. So it's another risk factor. Exercise can be good and bad. If it's done in moderation, it's good. If you overdo it, it can put you at a higher risk for AFib. Sleep disorders. What do we say about snoring, right? If you snore at night, I recommend that you go see a sleep specialist. There are things that you can do to stop that. And diet. Somebody asked me earlier about, or somebody made the comment that they drink Mountain Dew. Somebody had, I mean, who was it? I won't rat you out. If you want to volunteer that, Mountain Dew. If I drank 3 Mountain Dew in any 24-hour period, I wouldn't blink for a week. I doubt I'd sleep for 2 weeks.
Sleep counts. Exactly.
You don't blink much anyway. Anymore, you see kids drinking a lot of Mountain Dews and a lot of energy drinks, and they are loaded with caffeine and all kinds of stimulants. And I can't tell you how dangerous that is. It puts you at a really high risk to developing arrhythmias. Somebody else asked about smartwatches. You also, smartwatches, if you got one, they're good. And I'm getting this information from our lead EP physician, because this is an EP physician question. I wouldn't just answer it. He likes smartwatches. They provide good information. They're not as good as the cardiomobile devices that we use for our little screening. You probably see them on TV. They're like $120, but they'll do a 6-lead EKG. They provide 10, 20 times more data than a smartwatch. That said, a smartwatch is better than nothing, and it will identify atrial fib. So they're a good thing to have. So the take-home message is, these things are not fatal. You need to listen to your body. And when you have the symptoms, follow up on it. It doesn't have to be fatal. We can address them. They can be fixed. Don't ignore the symptoms. And it doesn't have to be that bad. I'm probably running out of time. I'm going to go ahead and wrap it up, but I'll be glad to answer any questions you might have.
What was the reason for, what would be the reason for athletes to come up, people that are in excellent shape?
That's another question for a physician, but the prevailing thought is that they're very lean, and with a lot of these, it's just no telling. There's so many things that cause it. It could be that they were going to have it regardless of what they're doing. The data don't show any specific pattern for that, but it does seem like we see a lot of.
So that device that goes in and sits in that,
Appendage.
yes, appendage. Does that you won't have to take blood thinners because of that? Is that in lieu of blood thinners?
You will. They usually take blood thinners for a certain amount of time, and usually that will replace the blood thinners. It wouldn't be required. because you're taking the blood thinners to reduce your risk of stroke. And that's comparable to blood thinners, so you wouldn't typically do both. Does that answer your question?
No, it does. I just wonder, some folks that are on blood thinners, like, the risk if you're in an accident or, you just bump your skin.
Right.
So that would,
Yeah, no, typically it replaces the blood thinners. Yes, sir.
Level of, AFib you need to be eligible for Watchman procedure.
That's a great question. I wish I had a great answer for you. I don't know that there's a level. I think if you have a history of paroxysmal AFib, I won't presume to answer that question. I think that's a physician question. So I apologize for that. Yes, sir.
Why do they call it a sinus rhythm? Sinus usually connotes, cavity.
Sinus, because it comes from the SA node. Remember in the beginning, I said every single heartbeat comes from one cluster of cells in the upper right chamber of your heart called the SA node. That SA stands for sinoatrial node. So that's why it's called. Any other questions? We said in the beginning, I made a point of saying that the cardiac muscle was important because every cardiac muscle cell in your heart is capable of producing an electrical charge or capable of being a spark plug. So that illustrates how complicated EP can be. I just wanted to come back and clear that up. Any other questions?
right, we have a special, I guess in lieu of a speaker's gift. Well, I guess you get this pen, right?
Yes.
You get a pen, but also we'd like you to sign this book, which we donate to our local library for our Jill's book program. And let's see, let's remember our trip to Phelps next week.
Did
Where can
everybody
everybody
get the sign up sheet? Did it make its way around?
Yeah, so we go here first.
No, we go straight to Phelps first. Yes, that's a good question. It's over there.
Any other announcements? Jan, if you'll send out that information about the Raleigh student by email. Anything else? Well, y'all have a great day.
Yes, sir.
Yes, sir.
Yeah.
All right.
Yeah. Okay, I'm not sure if you got it now or I was sending it. It's some to you, but because I'm not but I think this. So you should have. But anyway, I just figured somebody gave it. Yeah. Like how cool. Appreciate you speaking with us today. Also stuff. So we can- She's worked there 30 years.
Yeah. Nice to meet
Oh, okay.
Get out of here. You're gonna get lots of money. It's expensive. Yeah. If it ain't nothing.
No, it's already.
Get me up around it and I'll be number two. Yeah. It's gonna be one. They have that. We're gonna put in. Okay. If I didn't get you a check.
Yeah.
You sure? Okay. And you just go.
This one, you know, you're saying. I'll send it on.
I'll see, trust me. You go online there.
Oh, no, I mean, it's either that or I'm gonna run it through. This is.
Really?
Get the jokers in this one.
Hold on, camera 7 and 12, pan over to the first grade. You gotta show the video there.
That's great. It's a, see, yeah, and I understand I have to do that shop too, because I get charged out to use commercial services. But if you can afford it, I'll do it. I tell all my customers, listen, speak of it. Sorry, thank you. I tell them, yeah, it's right. This is the way I do my call.
Yeah, he thinks he brought me there.
Exactly. If there's ways to do it without it, that's what we'll do. Yeah, well, good. All right, so I'm gonna do that this year, right? If they don't, thank you.
Okay. Okay, so I got the 7, 9. Yeah, there's like 2 teams, so 2 cans, but 5 for the there, 5. And I'm not gonna be here next week. Because well, I guess, well, yeah, okay. We have board meeting on Tuesday. Hey, Dawn.
Yeah.
In the board meeting Tuesday?
Not this Tuesday, but next Tuesday. The third Tuesday.
Yeah.
It wasn't the 6th, it's not gonna be the 13th, it's on the 20th.
It is on
The board meeting, yeah, I mean, it's the third Tuesday unless somebody's changed it.
Okay, I'm just curious.
Okay. If I hear anything different, I'll let you know.
Okay, thank you.